Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Shinji Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a systematic order. You can make use of it. So we were discussing about the nephrotic syndrome and Ayurvedic understanding. The Dhatu Agni Mandya concept and its role in formation of Amavisha, and this Amavisha stimulating the body immune system abnormally and leading to the disturbed functions of Kapha and as well as Ojas that we have seen in the last class. Today we will have another important aspect related to Ayurveda in relation to nephrotic syndrome, that is involvement of the Medovaha Shrotas. Okay, now Dhatu Agni Mandya basically occurs at Medudot level, involving the Medovaha Shrotas as far as nephrotic syndrome is concerned. Dhatu Agni Mandya can occur at any Shrotas. But when I am focusing on nephrotic syndrome, probably this Dhatu Agni Mandya is happening in the Medovaha Shrotas. Why I am telling so? Okay, see, if you see the Mula of the Medovaha Shrotas, Vrikkam Moolam Vapahanancha. Mula of the Medovaha Shrotas is Vrikkam Moolam Vapahanancha. Kidney and as well as Vapavana. Okay. Now, Vrikka is not the part of Mutravaha Shrotas. Mutravaha Shrotas Moolam Basti Moolam Medrancha. So Vrikka will not come there. So this is the basic difference between nephrology and urology. Okay, Medavaha Shrotas concept, it is related to nephrology, whereas Mutravaha Shrotas concept is related to urology. Okay, so now Vrikka is a part of a, Vrikka contains nephron, it's a nephrology. So therefore Medavaha Shrotas Mula is a Vrikka and as well as Vapavana. Okay, but Mutravaha Shrota Mula is not Vrikka. So we have to make this distinction very clear. Okay, now Vrikka is not the part of Mutravaha Shrotas, rather it is a part of the Medovaha Shrotas. Now when I take a Vrikka, probably in Ayurveda, the Vrikka word refers to two things. It is kidney and as well as adrenal glands both. Okay, kidney and adrenal gland both, because there is no separate description of adrenal glands in Ayurveda. Okay, probably the portion, a cap-like portion which is present over the kidneys has been taken together in Ayurveda as a Vrikka. So if that is the case, we know that the adrenal gland and the secretions of the adrenal gland like cortisol, mineralocorticoids, etc., they play a very, very important role in the fat metabolism. Okay, maintenance of the fat metabolism. So Vapavahana, Medha, okay, so excess accumulation of the Medas, and Vapahana, that is also full of this momentum and all, that means the fat molecules and adipose tissues and all. So probably therefore they would have been told that Vrikkam Moolam Vapahanancha. Okay, so it is related to, more connected to the Medovaha Shrotas if you consider Meda as adipose tissues and some other fat materials, or a system which is responsible for maintenance of this adipose tissue, fat, etc., functional units. So that can be called as a Medovaha Shrotas. Now here in nephrotic syndrome, Medovaha Shrotas is involved because Vrikka is involved, because nephrotic syndrome is basically occurring in the Vrikka Pradesha. Okay, supporting to this, one of the first blood investigation when you see, what you find is it is the Meda which is increasing. Dyslipidemia is a major presentation of a minimal change in nephrotic syndrome, suggesting that there is direct involvement of the Medovaha Shrotas. Vrikka, that is kidney and adrenal gland, probably both are taken. So disturbed fat metabolism in the form of hyperlipidemia or dyslipidemia, cholesteremia, etc. in nephrotic syndrome clearly suggests the involvement of Medovaha Shrotas. So probably this is a disease related to Medovaha Shrotas, and our treatment should be planned accordingly. So Dhatu Agni Mandya is happening at Medovaha Shroto level. Medovaha Shroto level. And we have to plan the treatment now accordingly. Now, in related to the same, we can also take two more references, that is concept of Medha Avratavata or Medo Gatavata. Although this cannot be so well connected with the nephrotic syndrome, for the understanding purpose we can say the Medhavartavata. Okay, Medhavartavata, the symptoms are very clear. Chala, Snigdha, Mrudu, Shita, Shofa, and Angeshu Aruchi Stataha. Okay, Adhyavata iti Jnayaha Sa Kruchuho Medasavartaha. Medhavartavata can be also taken to some extent, and you can also follow the treatment principles of Medhavartavata. Okay. Then even the treatment principle of Amavata can be followed. Why? Because prameha vatamedagnehe amavate prayojayat. Treatment principles of amavata. However, many times I told that amavata is nothing but it is an autoimmune complex. It's the concept of autoimmune disorders in Ayurveda that has been mentioned as a amavata in Ayurveda. Okay, concept of autoimmune disorders. And why this amavata occurs? Because basically it is Agni-mandya. We know that. Okay. So what is the relationship of this ama in producing the autoimmune disorders? Just we have discussed in the last class. So therefore, so anyway, that's a different issue. We will discuss again. But here also we can take account of even the treatment of amavata for the treatment of nephrotic syndrome, thinking that it is an autoimmune complex. Similarly, medoso avartavata or medo gatavata. Even in the medo gatavata, so we will have guru anga, tudhyate atyartam, dhanda mushti hata stataha, sa ruk samrutaha, and mamsa medho conditions will be there. Okay, involvement of the mamsa and medha will be there. So this is just for our understanding, because we can make our treatment more focused, more precise, and more accurate by taking such references. Now all these things explains that there is ultimately there is involvement of the medas will be there. Medas get affected. The cause is basic cause is Dhatu Agni-mandya. Basic cause is Dhatu Agni-mandya because of ama. Now, progression of the disease as for Ayurveda. Now, how this progression in the modern science we have seen in the different steps, how the disease goes on producing the different effects like first stage, second stage, third stage, severe stage, etc. Similarly, in Ayurveda, when we talk, what is the progression of the disease in Ayurveda? So that we will discuss in the next class.